Hello. Okay, I think it's fine. Thank you very much. Like I said earlier, I am Giganze Pele. I'm a project director at Accountability International, and I will be moderating this session. We were expecting 2 parliamentarians that are not here, so the best thing is to continue with the program. I'm here with my panelist, Sheriff Motopeng. So I am going to give Sheriff an opportunity to introduce themselves and the work that they're doing, and we will proceed from there. Thank you very much.
Thank you so much, Kay. Maybe if there's a new legislator, a parliamentarian who'd like to join me, I just feel like I'm lonely. But, oh yes, honorable is there. Like Giganze has already said, my name's Sheriff Motopeng. I come from the Mountain Kingdom of Lesotho, and I work partly with Giganze as a consultant for Accountability International, but I do most of my work with Global Equality Caucus as the senior regional officer focusing in East Africa and Commonwealth. So that's in a nutshell who I am. Thank you. Just a conversation.
Thank you very much, Motopeng. So we're going to start with a very important question that sets out the tone of our conversation, which is centered around criminalization. So, Sheriff, would you share with us aspects of what is criminalization?
All right, thank you once again, Giganze. That's quite a broad question, but I would say criminalization is the use of punitive laws to police certain communities, especially marginalized communities, on the basis of gender identity, sexual orientation, and expression, on the basis of individual behaviors and practices. For instance, when you talk about criminalization, we know of a number of countries. Actually, I think I would say the criminalization of sex work in most African countries, and criminalization of LGBTIQ individuals, and criminalization of people who use drugs, to mention a few. We would know that in some countries, criminalization of sex workers would be punished under law of loitering. They will be accused of loitering, and they will get arrested. Where 2 consenting adults engage in same-sex relationships, they get arrested. Those are some of the punitive laws that are being used in Africa, and that's in a nutshell how I understand criminalization.
Thank you, Sheriff, for that clear and comprehensive explanation of criminalization. That there is, just to leverage on what you said, the use of excessive, punitive, arbitrary, unfair, and discriminative laws on bodily autonomy choices leads to that. And we find that in terms of criminalization, which is really widespread across the continent, it then limits expressions, it limits access to equitable health care, and it also really limits the uptake of treatment of HIV in our continent. So I'm going to come back to you, Sheriff, in terms of, extending the effects of criminalization. In your experience, how has criminalization shaped, access to health services for key and vulnerable communities in sub-Saharan Africa?
All right. There are a couple of points that I would like to raise in terms of the impact of criminalization in terms of access to health services. One would be fear of arrest by the communities that are being arrested, fear or harassment, which of course discourages service use. For instance, a number of people, a number of communities that are criminalized, especially when you talk about key populations, avoid visiting clinics to seek health services on the basis that they would be harassed either by the healthcare workers or the system itself, in the sense that, for instance, we do have forms that we fill in the health facilities that would probably only cater for two genders, which is male and female. So in a case where somebody identifies as a trans person, it becomes quite challenging for them to even seek such services. So they avoid going or seeking health services on that basis. Another one would be issues around stigma and discrimination from healthcare workers themselves, because these laws that criminalize the communities stigmatize behaviors, and they create an environment where health workers themselves may refuse to grant services to these communities. And thirdly, there is also an issue around high exposure to violence, where you'd find that the communities also remain vulnerable to violence, either from the police officers or from their clients or partners in the case of sex workers. And this also reduces legal protection, both of which will reduces control over protection or seeking protective health services. And as we have already mentioned, issues around punitive laws, which lead to withdrawal of prevention programs and the collapse of PrEP and PEP. And lastly, the criminalization itself also contributes to lack of access or seeking services on the basis of legal obstacles to basic identity care for transgender people, where lack of legal gender recognition and gender affirming healthcare becomes a challenge for transgender community individuals. That also because these communities are criminalized, it becomes difficult for them to seek health services on that basis. So I think those are some of the points that I would want to raise in terms of how criminalization affects access to services.
Thank you very much, Sheriff. You mentioned that there is interrelated issues that lead to, for example, reduction of legal protections, lack of appropriate uptake of services, as well as issues around gender legal recognition, gender affirming care. And we find that in sub-Saharan Africa, these are some of the key structural barriers that, disable key populations and vulnerable communities to access treatment and all the health-related services that they must, by virtue of their dignity and fundamental human rights, enjoy. I'm going to come back to Sheriff, then I will come back to our Honorable MP here. Thank you for saving our day. So, Sheriff, so that we can relate this to, uptake of services as well as perhaps building resilience and as well as political will, because political will is very, very important in access to services in relatively. So in your work with key population organizations, Sheriff, what strategies have proven most effective in building resilience and demanding accountability from policymakers?
Okay, thank you once again. There are a couple of strategies that the grassroots organizations that we work with engage. And those include building partnerships with the main actors, especially around policy change, engaging with legislators, with members of parliament in different countries has proven to be one of the effective ways of challenging criminalization in different countries in Africa. But mostly with the work that we do directly as Global Equality Caucus, there has been a lot of engagements in Southern Africa, which has recently expanded to East Africa and beginning one new project, a chapter in Western Central Africa. So our engagement with these policy makers, with the legislators, where we also realized that language itself was a barrier in terms of legislative process, legislative engagements that is related to key populations. So we try to create a platform for members of parliament to engage with community members, to also create a platform for members of parliament themselves, for legislators for a peer-to-peer kind of engagement where they get to share experiences of what has worked in different countries, because at the end of the day, every country would want to do better and to do well. So we realize that there's a gap in terms of information, because there's a lot of misinformation also that our legislators carry. Not only that, work around advocacy with healthcare workers. I think the work that I have done personally goes way back to the early 2000s, where we engaged with sex work, healthcare workers for sensitization purposes, where we tried to change and try to work around integration of healthcare services that are inclusive of key populations' needs. So work around advocacy, work around partnerships have proven to have worked quite well. So I think those are the two that are at the bottom of my head now, but I will come back to that question as we continue the discussions.
Thank you, Sheriff. So then I will ask our Honorable NP, welcome, Decent Bajila, MP, Member of Parliament from Zimbabwe. Thank you very much for your, I want to use this word, to agree to assist us. So there are a couple of questions that I will like to pose to you, and then in As an experienced legislator, what do you think, or in your observation or experience, how can parliamentarians use legislative oversight to challenge laws that stigmatize, that are discriminative, and that also criminalizes HIV?
Thank you so much. That's a very important question. From where I stand, it is important for members of parliament to start from a position of accepting that it is not possible for them to know everything, and therefore be open to learning, especially on issues where you have grown up, you have been socialized under certain legal barriers or under a certain dispensation. If you give yourself that kind of a learning spirit, it is possible for you to then learn and then understand how harmful the laws that exist in your country are to fellow citizens. And also they may be harmful to yourself in the sense that in this case, laws that are harmful to the fight against HIV, eventually they are harmful to all of us, because HIV affects all of us, and all of us, we are in one way or another prone to HIV. So that is the fundamental thing, to appreciate that there are things you might not know. Once you have appreciated that there are things you might not know, it then gives you an open mind using which you can then interact with activists from outside parliament, and you can learn from them, and you can then be able to advocate for changes in certain ways or in certain aspects of the laws of your country. We have a classic example in Zimbabwe, where we have, he spoke about loitering, those kinds of laws where people get arrested and you are accused that you are loitering. And then at one point I posed a question to the Minister of Justice and the Minister of Police, which we call Home Affairs, to say, can you please give us statistics during this specific period of how many people you arrested for selling sex? Also give us statistics of how many people you arrested for buying sex during that same period. The numbers were not tallying. In fact, there was 0 on the side of those arrested for buying. And so then we get to ask, so when you arrested all these people for selling sex, who were they who was buying from them? Who were they selling to? So once you begin to question things at that level, appealing to the logic of the laws you have, to say, is it logical that you are arresting people for selling sex and no one has been arrested for buying? What kind of a law is this? Once you do that, you begin to appeal to the logic, and then you can win more people on your side, because things that have to do with criminalization and decriminalization are about winning the number of people who are essential to law formation to a specific site. That's how I think as legislators we should approach these kind of issues. I thank you.
Thank you very much, MP. From what you said, it's very, very important to learn. And I think that's a critical aspect, you know, because MPs are legislators, they're lawmakers, so they have to have the capacity to know, like you're saying, what is harmful, what is positive, what is protective, what is respectful in terms of adhering particularly to respecting of fundamental human rights, which leads to, you know, sustainable and well-developed countries, as well as, you know, the promotion, protection, and fulfillment of human rights. Mutupeng, I'm going to pose this question to you because MP Bajila has talked about data and evidence. I would just like to know your take from that aspect as a researcher. How important is data or evidence in terms of really using a rights-based approach in relating to our topic? Thank you.
That's quite an interesting question because I do remember this conversation I once had with one member of parliament from Lesotho. I was asking as to how they collect data as different ministries of government, and he did mention that they don't have a budget for researchers. Okay, interesting. So if there's no budget for researchers and we do have data that is collected through participatory action research, which is lived realities of the communities, but this data, because it's not scientific, but it is the reflection of lived experiences of these individuals. Why is it not being used? Because for me to stand here and say, I have been denied services at a particular clinic because of my gender identity, because my identity document says this while my physical expression says otherwise, and I've been denied services. And you do not want to believe my story because it's not a scientific story, yet it is my personal experience. So when it comes to issues of data, I did mention this earlier when we were in the plenary that community research should not be taken for granted. We do under Accountability International collect data through the same method of participatory action research, which is quite a very powerful method of data collection, because that is where people get to share their experiences. It's unlike when you sit down and you are saying how many people got this injection, how many people have access to this. People sit down in a room and share their own experiences, and these experiences are taken for granted because somebody from somewhere has to say, yes, this is how data should look like. It is classified as anecdotal because it's not something that's scientific. So I think talking about data, talking about research, which of course in most countries we will always get a feedback that we do not have data on this issue, so we are unable to implement. Whose responsibility is it to have that data? Is it us as the community? If it's us as the community, then why do we not have access to funding? So it's a huge challenge. It's a huge gap. We try, even through using the scorecards, because I do know that there are a number of scorecards that were developed under Accountability International. One of them includes health financing, which was done a couple of years ago, and I think those scorecards were developed because there was a gap. Unfortunately, nobody finds them important. And these are tools very easy to use for our policymakers, very easy to read because it's not scientific data, it's people's stories that you can sit down and have a conversation about. So I guess it is very much important for our policymakers, for our legislators to take into consideration those scorecards, those barometer reports, some of those tools that communities develop, and use them as they develop policies, because they do inform the work, they do inform the kind of policies that will respond to communities to have access to services. So that's my take on that.
Thank you, Sheriff, for highlighting the importance of really also, apart from scientific research, to use community-based research or participatory action research, which is really interactive and takes the views, the lived realities of communities. So, Mr. Bajila, I'm going to ask you about, Sheriff asked about something that's very important, budgeting, financing in terms of research. In your observation as well as experience, how do you think parliamentarians can, you know, maybe take advantage, or what interventions can they be able to use to get some sort of budgeting from the governments to be able to drive data related research, as well as, you know, getting the lived realities experiences from communities?
Yeah, thank you so much. Let me start by giving the Zimbabwean scenario. The Zimbabwean scenario operates in a way where there are portfolio committees of the National Assembly. Each portfolio committee does oversight over one or more government ministries. At staff level, each portfolio committee has a committee clerk and a committee researcher. So each portfolio committee of Parliament has a researcher, and this is a very important position which I think that it needs to cascade across all African parliaments, so that we have a dedicated one or more technical person who should do the research. As I am currently the acting chairperson of the Portfolio Committee on Health, we recently had an outbreak of hand, foot and mouth disease. We tasked the committee researcher to go and do some research. What kind of a disease is this? How prevalent is it? In which provinces, in which committees, and so forth and so forth. That then makes our legislative work to be evidence-based. It must not be based on vibes, as we have seen in other instances. So it is important to have that position. But quite recently, the Speaker of Parliament of Zimbabwe signed a memorandum of understanding with one of our science universities in the country for the development of artificial intelligence tools that members of Parliament need to be able to use, and then the teaching and so forth of those artificial intelligence tools will be done within the Zimbabwean context. And it is also important in terms of getting to modernize how members of Parliament get to operate. Thirdly, all these things, when they are in place, the issue of artificial intelligence, the issue of having clerical staff capable of doing these kinds of researches, must not replace the individual efforts by members of Parliament in getting to know realistically what is happening on the ground. Not everything must be based on desktop evidence and so forth and so forth. It is important for members of Parliament to be able to interact with the real people who have got real problems, who have got real ideas in terms of what solutions need to be put out there. So the question of budgeting, allocating resources for members of Parliament to be able to do these things is very important. In the Zimbabwean context, we do have a certain resource called constituency visit, where once a month a member of Parliament is entitled to this kind of resource where they can go to around their specific geographical constituency to be able to hear things out there. Of course, that also is a model that that may need to be developed further. But it must also hinge on my earlier point that I said, the willingness to learn. Because not everyone is elected into Parliament on account of their abilities to comprehend a certain phenomenon. So doesn't matter what AI tools are put, it doesn't matter how much members of staff you have for your capacity to research, doesn't matter how much resources are placed in front of you to be able to do tours and understand things. If they have no willingness to learn and comprehend new issues, you will still be unable to represent your communities well?
Thank you, Honorable, for sharing with us and giving great insights, as well as that there is progress in Zimbabwe in terms of modernization of, interaction of AI and how parliamentarians can use that. I think that's really, really good. I am going to pause here and open for questions, comments, inputs, and that. So, okay, there's already a hand. So.
Good afternoon, everyone. My name is Malamanele Koko. I'm from Botswana, and I'm a program director from one of the local NGOs. We have a JP focused program, hence I have interest in this topic. Also, our country is still at infancy in terms of decriminalization. I have 3 questions, but I'll limit them to 2. The first question will go to Honorable, just to give us how the legislature is ensuring that HIV-related policies are grounded in evidence rather than moral or political sentiments. The second question will be to the panel and indeed to the attendees in the room. It's what strategies exist for neutralizing political resistance for decriminalization, especially when the resistance is culturally or religiously motivated. Thank you.
Thank you, Mr. Lekoko. Another question? There's another question? Okay, there's...
I think mine is a comment, and I think it's very important that as parliamentarians use different tools to be able to do a due diligence in oversight on laws that has been said that it enforces stigma and discrimination, therefore hindering in health interventions and service provision, because health issues affect all of us. And so if we, out of political will, we are not interested in making sure that these laws that are put in place are not able to prevent stigma and discrimination in order for key populations to access health adequately, we realize that the end repercussion becomes that the same issues that we are fighting keep repeating itself, and we introduce new systems and mechanisms and go around it for a very long time, but the issues we are facing keeps persisting. And so it is very important that there should be political will and commitment towards members of parliament, making sure that institutions and government bodies that are regulating health institutions are able to account for the harm that these laws, these discriminatory laws in place, what they are doing to the health system, and also how it affects people who are supposed to access health and they are not able to because of these health, these laws that exist.
Thank you very much. I have a couple of questions. I think my question... We still have 5 more minutes, right? Oh, thank you very much. I thought you were stopping us. So I will, yes, there's a,
Thank you. I'm just curious. I know we don't have very many female MPs on the continent. Are there